Do you have weak ankles? Look at this. There's a lot of muscles along this ankle right here. There's a big lie. All these YouTube videos, all these pages, they're showing you the 3 best exercises or 5 or 10 best exercises. That's not the truth. I'm gonna show you how to really get strong ankles, and it's easy. You can do it today and your ankles will feel better today. So watch this guide. Look at all these muscles. On the outside, you have your peroneal tendons. On the inside, you have your posterior tibial tendons. On the back, you have your Achilles tendon. As I come off here, there's fat pads that can be inflamed. The peroneal tendons right here can be inflamed. Look at, as all these things fall off here, the posterior tibial tendon, right here, you could have a sore subtalar joint. You could have a sore ankle. This is the big lie. It's not muscles that are too weak to get you through the day. It's overworked, sore muscles. Pretend you go to the gym. The single reason people don't get big strength gains are they either don't work out at all or they overtrain their muscles with too many reps that they wake up sore the next morning, then they don't want to work out anymore. If I went to the gym and I just did the bench press 20 times every single day, 7 days a week, my chest muscles would not get bigger. They'd get so sore I wouldn't be able to move. And that's what's happening with your ankle. People stand 12 to 14 hour days, and then on top of that, you're supposed to stretch and exercise your muscles. Here's what's really going on. When you wake up in the morning and your ankles are, this is breaking on me. If you wake up in the morning and your ankles are so sore through the sides, through the inside, you actually have microscopic tears through your muscles. That's why your ankles are sore. This is true for runners, for joggers, for basketball players, for people on their feet 12 to 14 hours a day. This is why you have weak ankles, not because you don't have bodybuilder type calf muscles. What you have to do is you have to support your feet and your ankles. So number one thing is, if you're so sore in your ankles and you're an athlete, you have to cross train. So if you're a runner or if you're just doing the elliptical or treadmill, switch to the bike for a few weeks. Go to the pool, switch to squats, switch to deadlifts, switch to doing the bench press, switch to pull-ups. Start doing some weightlifting rather than only running. You have a lot of muscles in your body. Don't just use your ankle muscles to carry your body weight for all your exercise. Look at professional athletes. They're not just walkers. They're not just joggers. You can't get in great shape just walking and jogging. You're simply overloading your weaker ankle muscles and killing them to the point that they can't get stronger. So you have to cross train. People who work all day, go to your HR department, go to your podiatrist, and potentially get a note. Try and do some sit down, get a foam mat, rest those muscles so they're not getting bruised up 12 to 14 hours a day. I know not everybody can do that, so there's some better solutions coming too. But here's the easiest solution. I have a lot of factory workers who are on their feet all day. You want to get a great pair of work boots that hold your ankle. If you can't do that, you can get a good shoe. So a stiff back, a stiff sole, and something that bends in the front. You then want to get an orthotic to put in there. So why an orthotic? Look at right here, when you land, look at how my foot bends. All those muscles on the inside of the ankle, they get stretched. They have to spasm to try and turn your foot back in. So see all these muscles on the inside right here? They are flexing permanently to try and turn your ankle straight. So all your ankle muscles are spasming to keep you straight. But watch this. When you go in a nice custom orthotic with a deep heel cup, see how I'm pushing? Nothing's collapsing. But watch this right here. See that? I know you think that's a trick, but it's not. You can get your own foot model and you could do that. You could practice that with your foot. I actually show that to patients with their foot. So a good shoe, a good insole, cross train. Another thing you can do is you can get an ankle brace. So an ankle brace is pretty affordable. That's like $10 to $20 online. And there's some great links in the show notes, but an ankle brace will help you keep it even straighter. A taller boot will keep it even straighter. If you do all those things, then as about 2 weeks, 3 weeks, 4 weeks come by, your muscles start to heal, those microscopic tears heal, and then you can start exercising. So here's some great exercises that you can do for your ankles.
A great thing to do is to get yourself a water bottle, put some water in it and freeze it. After a little while, massage your calf, your plantar fascia, the soft ankle muscles, the front of your ankle. A couple minutes of this will really cool down your muscles and loosen them up.
Everyone always wants to know exercises, so here it is, a massage roller stick. This is $10 or less online. Check the show notes. But you have to massage out your calf muscle, your Achilles tendon, even your plantar fascia. Studies show that doing this for 30 to 60 seconds per muscle group gives you a few hours of relaxed and flexible muscles. So even for the plantar fascia, I love to massage the plantar fascia. The idea is you're squeezing the fluid out of the ligaments, the tendons in your foot, in your calf muscle. So the ball doesn't work great anywhere except the bottom of your foot. You want to use the massage roller stick I was using on your calf and your Achilles tendon, and you can use it on your thigh too. You want loose thigh muscles, loose hamstring muscles, so there's less pressure on your calf muscle, but you could really focus time on your Achilles tendon, but you don't want to damage it. You don't want to hurt it. And look it, for a couple hours afterwards or a work shift afterwards, you can then stretch. So now I'm gently stretching my Achilles tendonitis. You never, and I repeat, never want to cause pain. If something is torn, if something is partially torn, or if you have crippling pain while stretching, stop. That means you have to heal, you might have an injury, and you have to get that checked out with your podiatrist or foot care specialist, because you could be spreading and tearing further. But look at, before that massage and gentle stretch, I couldn't even touch my toes. But now look at, way past my toes. You know, if I really keep doing this, sometimes I can make it all the way up to my elbow. Whereas in the morning when I get up, I can't even touch my toes. That's insane. So that's how much the massage and the stretching combo does. So tell us if that worked for you, because these methods do work for pretty much all patients that we see. They quickly get better. And I'm talking like 20 to 30% better per month. But after like 2 to 3 months, your ankles are stronger, your muscles are stronger, you can get through your work shift stronger. So do that. Don't exercise damaged, injured muscles in your ankles.
If that helped, check out some of these videos and subscribe. We love our subscribers, and ask in the comments if you have any questions and let us know if that helped and how you got your ankle pain.